Milwaukie Hospital is a community hospital in an urban setting. Our patients have choices of where they want to receive care, and we know that our patients locally have confidence and they choose to come to Milwaukie Hospital. They come to Milwaukie Hospital both for acute services and also when they need critical care. Most of our patients come from the zip codes really close to the hospital. It's really important for our ability to serve the community to have the breadth of services of critical care and acute care to meet the patient's needs.
In hospitals in general, when people get admitted, they can be admitted to a regular medical floor, and you never know when things are gonna kind of turn for the worse. And so many of our patients that I see, they're always saying, "Oh, I love this small hospital. I love this small hospital," because it really just does have like a more community feel.
Despite our small size, we fully expect to offer the highest quality and care available in Portland. We have found that by using telehealth, we can safely manage many patients locally that otherwise would require transfer. Transfers, especially of critical care patients, are very complicated, high risk, costly, require a lot of coordination. If the patient can be safely managed locally with the collaboration of the intensivist via telehealth, we improve the quality of care and keep the patient in their community.
Our stroke program now, we're able to give the clot-busting drug at our hospital and then keep that patient. And we used to have to transfer them out. And that's made a big difference for this community because, if you live a block away and you suddenly have stroke-like symptoms, we know for strokes, the quicker you can get to care, the better outcome you're gonna have. And so having a hospital in your own community that can provide some of that care is huge.
It's really important for us to invest in Milwaukie Hospital because we are so central to the Milwaukie community. We know that there are choices where donors can give money, and this is a worthwhile cause. We continue to serve the local community here in Milwaukie, and so the money stays local here in the community.
Everyone on this team cares a lot. That's why we went into this field. And we want to see our patients do well, and we want to feel like we are doing everything we possibly can for them. Just wave after wave of COVID patients that have come through, I think, resources have been hard to attain, whether it's staff, nurses, doctors, equipment, open beds, and the stress of not knowing if you're gonna have what you need to take care of your patients has been very draining and feeling like it's never gonna end. And so I think that's been hard. I think if we were always fully staffed, if we always had open beds, that would take off a lot of the burden and kind of mental space that we're using so that we could just focus on taking care of our patients.